The U.S. is first in healthcare spending and 48th in life expectancy, and we need to do better.
The rates of cardiovascular disease and cardiovascular risk factors are expected to grow at a tremendous rate. By the year 2050, we can expect that over 60% of the population is going to have cardiovascular disease, diabetes going up to 25% of the population, hypertension going from 50 to 60% of the population, and obesity from 40% to 60%. The costs of this are going to be astronomical. We expect a tripling in the costs for cardiovascular disease, going to $1.8 trillion a year. These costs are going to become unsustainable.
And we need to do better in terms of figuring out what are cost-effective ways to improve the health of Americans.
And food is medicine, we think, is a great way to go about doing that.
I don't think anyone would argue with this notion that the food is medicine system that we can all imagine is going to require a lot of really broad and diverse capability, much of which doesn't actually exist in full, and in many cases not even in part yet. The aim of this systems convening is actually to work on those challenges, to identify opportunities for change, and issue public calls to action. Equal parts vision setting, strategy development, and field building.
The Healthcare by Food initiative is designed to be collaborative. It is a human-centered design model that bridges the academic research environment with the practitioner experience.
We've broadened the group of stakeholders that are in the room. We really have voices represented across the system, from the food systems, healthcare, policymakers. Every voice, every decision maker in this process is in the room today, helping us look at a very complex system and make it more simple.
We have 12 different work groups that are working intensively over the course of the day on a variety of areas, technology to changing consumer behavior, to thinking about the policy landscape, to research, and we're looking for very tangible output.
And so what I hope we do is we build a system to disrupt the status quo, to make sure that we determine what needs to change, how that needs to change, and what we are going to do in this room to take those actions to drive that change.
We tend to reinforce the same systems and structures we have, and we know that they don't work. But I don't think that we're going to get to health equity if we only think about it as our outcome and not embed it within all of the processes. How do we do this differently and make sure that we're embedding the equity within the processes too? And I think we have a great platform for that based on what we did today.
We know that there are really important answers to the hard questions embedded in each sector here. And the American Heart Association is uniquely positioned to convene these sectors. We know we're going to uncover a lot of new information that's going to help us redesign a system that's best for people to get healthy food.
And be sustainable.
Yes, exactly.
So one way I think about systems change is that it's the exercise of swimming in complexity and remembering how to breathe. We're really mashing two sectors together, trying to work on individual behavior change, trying to base our work on nutrition science, which is ever evolving in and of itself. I was listening amidst that complexity for what are the things that feel actionable and solvable right now. Clear definitions and universal terms, and starting to have a really honest conversation around standardization. I heard we just need more discourse around the evidence and what metrics and measures matter most to whom. How do we get utilization up? And there are programs out there that have incredibly high utilization rates, and we should be learning from those programs.
When I talk to healthcare pretty constantly, their issue, it's member engagement. They can't reach them. They're hard to reach, unengaged, distrusting. We have to figure out how to interoperably connect the system so that we're all aware of who's lost in real time.
The future for food is medicine is really bright. American Heart Association has done a tremendous job of bridging science with policy and community engagement and involvement, and that will continue with Healthcare by Food.
Nelson Mandela said, "Everything is impossible until it's done." Remember that you are the keepers of the flame, that this is the right thing to do, and to fix it all the way, the whole food system from the human to the earth. And if you keep that flame alive, then this wins, right? That's the winning answer, right? We don't have every single answer worked out, but you have the vision, you have the commitment, you have all the pieces. They sit in this room and in the groups around this room who believe in it. Remember that as you go forward. The answers are here.
We have the ability to generate the kind of evidence and design the kind of programs that could help tens of millions of Americans improve their health. And it's really exciting to be part of a team that has a chance to have some positive impact on these very important challenges.